Have you found yourself dozing off more frequently during the day as you've gotten older? Maybe you've noticed a parent or loved one catching those cat naps in their favorite chair more often than they used to. While many dismiss daytime sleepiness as just another normal part of aging, the truth is that excessive daytime sleeping in seniors can actually be a window into your overall health and well-being, and sometimes it's signaling something that needs your attention. When Margaret, a vibrant 72-year-old who had always been the energetic matriarch of her family, started falling asleep during her beloved book club meetings and afternoon card games, her family initially thought it was just getting older. But the truth is, daytime sleepiness isn't simply an inevitable part of aging. It's often connected to underlying issues that can significantly impact your quality of life, independence, and even longevity if left unaddressed. In this video, we're going to explore 5 critical aspects of daytime sleepiness in seniors aged 60 to 80, how it connects to nighttime sleep disruptions, the medication factors many doctors miss, the surprising link to cognitive health, the physical activity connection that transforms energy levels, and finally, the hidden emotional and psychological dimensions that might be affecting your sleep-wake cycle. Stay with us until the end, because in our 5th point, I'll share a particularly overlooked aspect of daytime sleepiness that could completely change how you approach this issue, giving you the power to potentially reclaim hours of productive, enjoyable waking time each day and significantly improve your overall quality of life. The first critical factor behind excessive daytime sleeping is disrupted nighttime sleep. While it might seem obvious that poor sleep at night leads to drowsiness during the day, what's often missed is how differently sleep disruption manifests in seniors compared to younger adults. Many people overlook this connection because the disruptions themselves can be subtle or seemingly minor. You might think that waking up once or twice during the night is normal as you age, and to some extent minor changes are expected. However, when these disruptions become frequent or prolonged, they create a cascade effect that dramatically impacts daytime alertness. From a physiological perspective, aging naturally affects your sleep architecture, the natural progression through different sleep stages throughout the night. After age 60, many people experience a reduction in deep, restorative slow-wave sleep and more time in lighter sleep stages, making you more vulnerable to awakening from environmental stimuli, pain, or the need to use the bathroom. This fragmentation prevents your brain and body from completing essential restorative processes that occur during uninterrupted sleep cycles. The impact extends beyond just feeling tired. When nighttime sleep is fragmented, your brain attempts to compensate by inducing sleep during daytime hours, often at inappropriate times. This doesn't just affect your energy, it can impact your mood, making you more irritable or even depressed. Physically, chronic sleep disruption can weaken your immune system, making you more susceptible to illnesses, and can even affect your balance and coordination, increasing fall risk. Let me share some examples of how this manifests. You might find yourself waking multiple times to use the bathroom, a condition called nocturia that affects up to 80% of older adults. Or perhaps you're experiencing sleep maintenance insomnia, falling asleep easily but waking in the early morning hours, unable to return to sleep. Another common pattern is called advanced sleep phase syndrome, where you find yourself getting sleepy unusually early in the evening and consequently waking very early in the morning. When you notice these patterns, there are several effective strategies you can implement. First, maintain a consistent sleep schedule. Going to bed and waking at the same time every day helps regulate your body's internal clock. Limit fluids several hours before bedtime to reduce nighttime bathroom trips. Create an optimal sleep environment by ensuring your bedroom is cool, dark, and quiet. Consider investing in a supportive mattress and pillows that accommodate age-related changes in comfort needs. If sleep disruption persists despite these measures, consult with a healthcare provider who specializes in geriatric care or sleep medicine. They might recommend a sleep study to identify specific issues like sleep apnea, periodic limb movement disorder, or other treatable conditions that are more common as we age. Now, while nighttime sleep quality forms the foundation of daytime alertness, there's another critical factor that many seniors and even healthcare providers frequently overlook: how the medications in your cabinet might be secretly stealing your daytime energy. The second crucial factor affecting daytime sleepiness in seniors is medication side effects, what I call the hidden energy thieves. This is particularly important because, unlike natural sleep disruptions, medication-induced drowsiness is often mistaken for normal aging, or attributed to the condition being treated rather than the treatment itself. What makes this especially confusing is that daytime drowsiness differs significantly from the sedation you might expect from obviously sleep-inducing medications like sleeping pills. Instead, many common medications prescribed for age-related conditions can cause subtle, accumulating drowsiness that builds up over time, making it difficult to connect the dots between your prescriptions and your increasing daytime naps. The science behind this is fascinating, but straightforward. Many medications cross the blood-brain barrier and interact with neurotransmitters that regulate wakefulness and sleep. Additionally, as we age, our liver and kidneys process medications more slowly, meaning drugs stay in your system longer, prolonging their effects. The fat-to-muscle ratio changes as well, affecting how medications are distributed and metabolized in your body. This drowsiness doesn't just affect your alertness, it can impact your cognitive function, making thinking and processing information more difficult. Socially, it may cause you to withdraw from activities you once enjoyed because you simply don't have the energy. Physically, medication-induced drowsiness can increase accident risks and falls, a leading cause of injury among seniors. Common culprits include antihypertensives, blood pressure medications, like beta blockers, which can reduce alertness as a side effect. Antihistamines, even those in over-the-counter sleep aids or allergy medications, are particularly problematic as they have anticholinergic properties that can cause drowsiness, dry mouth, and even confusion in seniors. Certain antidepressants, particularly older tricyclic medications, can cause significant daytime sleepiness. Even drugs used to control bladder problems or gastrointestinal issues often have sedating properties that can accumulate over time. A common misconception is that if drowsiness isn't listed as a major side effect or doesn't occur immediately after starting a medication, it isn't related to the drug. Another misunderstanding is that if a medication has been well tolerated for years, it couldn't suddenly start causing problems, when in fact, age-related changes in drug metabolism can make previously well-tolerated medications problematic over time. If you suspect medications might be contributing to your daytime sleepiness, there are several steps you can take. First, create a complete list of all medications you take, including prescriptions, over-the-counter drugs, and supplements, and review it with your pharmacist or healthcare provider. Ask specifically about sedating effects and whether dosages should be adjusted for your age. Never stop medications abruptly, but discuss the possibility of alternatives with fewer sedating effects. Consider timing adjustments, taking medications with sedating effects in the evening rather than morning when appropriate. Remember that deprescribing, the process of systematically discontinuing medications that may no longer be beneficial or may be causing harm, is becoming an important part of geriatric care. A medication review could identify drugs that are no longer necessary or could be replaced with non-pharmacological approaches. As we transition to our next topic, keep in mind that while optimizing your medications can significantly improve daytime alertness, there's another dimension of daytime sleepiness that's often overlooked despite its profound importance. I appreciate you staying with me so far. This information on sleep disruption and medication effects is crucial for understanding daytime sleepiness, but we're just getting to some of the most important insights. If you've experienced either nighttime sleep disruption or suspect medication side effects might be affecting your daytime alertness, I'd love to hear about it in the comments below. Has a medication review ever helped improve your energy levels? Don't forget to subscribe for more evidence-based health information for seniors that goes beyond the basics and offers practical, actionable advice. Now let's explore the fascinating connection between daytime sleepiness and something many seniors worry about: cognitive health and brain function. The third critical aspect of daytime sleepiness in seniors is what I call the cognitive connection, the complex relationship between excessive daytime sleeping and changes in brain health. This factor deserves special attention because, unlike the previous points we've discussed, the cognitive dimension can sometimes be both a cause and a consequence of altered sleep patterns. This connection is particularly important because many people miss the early signs, attributing cognitive changes to just getting older, rather than recognizing them as potentially modifiable aspects of brain health that are intimately connected with sleep regulation. To understand this relationship, we need to look at how sleep and cognition are neurologically intertwined. The same brain regions that regulate sleep-wake cycles, particularly the hypothalamus and brainstem, also influence attention, memory, and executive function. Additionally, the glymphatic system, the brain's waste clearance mechanism, works primarily during deep sleep to remove proteins and waste products that accumulate during waking hours. When this system is compromised by fragmented sleep, it can potentially accelerate cognitive decline. The emotional dimension of this connection is significant for both seniors and their caregivers. For the person experiencing these changes, the fluctuations in alertness can be frustrating and concerning, sometimes leading to anxiety about developing dementia. For family members and caregivers, distinguishing between normal age-related changes and potential warning signs can be challenging and emotionally taxing. There are several cognitive conditions where increased daytime sleepiness warrants immediate attention. If daytime sleepiness occurs alongside symptoms like increased confusion in the evening hours, sundowning, significant short-term memory problems, difficulty finding words, or changes in personality or judgment, it's essential to consult a healthcare provider promptly. These could be early indicators of conditions like Alzheimer's disease, vascular dementia, or Lewy body dementia, where sleep disturbances often appear as early symptoms. Even in the absence of dementia, there's a condition called mild cognitive impairment, MCI, that can be associated with changes in sleep patterns. While not all people with MCI develop dementia, the combination of cognitive changes and new sleep disturbances warrants investigation. For long-term management of the cognitive-sleep connection, several strategies have shown promise. Cognitive stimulation through mentally engaging activities like learning new skills, solving puzzles, or participating in social interactions can help maintain brain health and potentially improve sleep quality. Light therapy has shown benefits for both cognition and sleep regulation, particularly for those who experience sundowning or disrupted circadian rhythms. Physical exercise, even moderate activities like walking, has been shown to both improve sleep quality and support cognitive function. It's also important to maintain good sleep hygiene practices with even greater attention than younger adults might need. This includes limiting daytime naps to 30 minutes or less before 3 p.m., avoiding caffeine after midday, and establishing pre-sleep routines that signal to your brain that it's time to wind down. If you're concerned about the cognitive sleep connection, consider seeking evaluation from a geriatrician, neurologist, or sleep specialist who can conduct comprehensive assessments and distinguish between different causes of cognitive changes and sleep disturbances. Early intervention is key, as addressing sleep issues may help stabilize or even improve cognitive function in some cases. As we move toward our next point, remember that while the brain-sleep connection is crucial, there's another physical dimension that's often underestimated in its power to transform sleep patterns and daytime energy. The fourth critical factor in understanding daytime sleepiness in seniors is what I call the physical activity paradox, the sometimes counterintuitive relationship between movement, energy, and sleep. While it might seem logical that conserving energy by resting more would leave you more energized, the opposite is often true as we age. Moving more actually leads to better energy levels and less inappropriate daytime sleepiness. This paradox confuses many people because the immediate response to fatigue is usually to rest more, creating a cycle that can actually worsen the problem. When fatigue leads to inactivity, which leads to more fatigue and more daytime sleeping, you can find yourself in a downward spiral that's difficult to break. The science behind this phenomenon is multifaceted. Regular physical activity improves cardiovascular efficiency, delivering more oxygen to your brain and tissues with less cardiac effort. Exercise also stimulates the production of brain-derived neurotrophic factor, BDNF, which supports brain health and proper sleep-wake regulation. Additionally, appropriate physical activity helps maintain muscle mass and joint mobility, reducing the discomfort that can interfere with nighttime sleep. The progression of this cycle typically begins gradually. Perhaps you find yourself slightly more tired one day and decide to skip your usual walk. The next day, you feel even more fatigued and again choose rest over activity. Before long, significant muscle deconditioning begins, a process that can happen surprisingly quickly in older adults, making subsequent physical activity more difficult and uncomfortable, further reinforcing the cycle of inactivity and daytime drowsiness. Quality of life considerations here are substantial. Beyond sleep improvements, maintaining physical activity preserves independence, social engagement, and the ability to participate in meaningful activities, all factors that contribute to overall well-being and life satisfaction. Consulting professionals becomes particularly important when you notice a sudden decrease in energy and increase in daytime sleepiness, especially if accompanied by symptoms like unusual shortness of breath, dizziness, or pain with movement. These could indicate underlying conditions like anemia, heart problems, or orthostatic hypotension that should be addressed before beginning a new exercise routine. For daily management of the activity-sleep connection, the approach should be gradual and consistent. Start with just 5-10 minutes of walking or chair exercises if you've been inactive, gradually building to the recommended 150 minutes of moderate activity per week. Focus on activities that you enjoy and that incorporate multiple dimensions of fitness: cardiovascular endurance, strength, flexibility, and balance. Timing matters significantly. Morning exercise has been shown to help regulate circadian rhythms and improve nighttime sleep quality for many older adults. However, finding the time of day when you have the most energy and motivation is most important for establishing consistency. A common misconception is that exercise needs to be strenuous to be beneficial. In reality, gentle activities like Tai Chi, water exercises, or even household chores provide significant benefits for sleep regulation in seniors. Another misconception is that it's too late to start exercising in later years. Research consistently shows that beginning exercise programs, even in your 80s or 90s, can yield significant improvements in sleep, energy, and overall function. Remember, the goal isn't athletic performance, but rather consistent movement that you can maintain over time. Partner with allied health professionals like physical therapists who specialize in geriatric care to develop appropriate, safe exercise programs tailored to your specific needs and abilities. As we prepare to discuss our fifth and perhaps most revealing point, consider how these physical aspects of daytime sleepiness connect with the emotional and psychological dimensions we'll explore next. Thank you for continuing to watch this important discussion about daytime sleepiness in seniors. We've covered some significant ground, from sleep disruption and medication effects to cognitive connections and the physical activity paradox. I'm curious, have you noticed a connection between your activity levels and your daytime energy? If you've found specific types of exercise particularly helpful for improving your sleep patterns, please share your experiences in the comments below to help others in our community. If you're finding this information valuable, please hit the subscribe button to ensure you don't miss our upcoming videos on healthy aging, including our series on maintaining independence as you age. Now let's move on to our fifth and perhaps most overlooked aspect of daytime sleepiness, one that might completely change your perspective on this issue. The fifth and perhaps most profound factor influencing daytime sleepiness in seniors is what I call the emotional dimension, situations where sleep becomes not just a physical need, but a psychological escape. This aspect is often the most overlooked, yet can be the most revealing when understood properly. This dimension is frequently missed because, unlike physical causes of sleepiness, the emotional factors can be subtle and sometimes hidden even from ourselves. In our society, we often focus on the physical aspects of health while giving less attention to emotional wellness, particularly in older adults where mental health concerns may be stigmatized or dismissed as inevitable aspects of aging. To understand this dimension fully, we need to recognize that sleep can serve psychological functions beyond rest. For some seniors, increased sleep becomes an unconscious coping mechanism for dealing with life transitions, loss, understimulation, or feelings of purposelessness. The brain essentially creates an escape through excessive sleep when waking life becomes less rewarding or more challenging. The detailed explanation involves several psychological mechanisms. Sleep can temporarily alleviate feelings of depression or anxiety by providing escape from troubling thoughts. In some cases, sleeping more may be linked to reduced production of motivational neurotransmitters like dopamine and serotonin, creating a bidirectional relationship between mood and sleep changes. Additionally, the brain's reward system can become less responsive to everyday pleasures as we age, particularly without conscious effort to engage in meaningful activities, making sleep relatively more rewarding by comparison. This emotional dimension connects intimately with the previous points we've discussed. Cognitive changes can cause frustration and anxiety that make sleep an escape. Physical limitations that reduce participation in previously enjoyed activities can lead to a sense of loss that manifests as increased sleep. Even medication side effects can worsen emotional states, creating a complex interplay between physical and psychological factors. When this type of emotionally driven daytime sleepiness requires immediate attention, is when it's accompanied by signs of clinical depression or anxiety, persistent sadness, loss of interest in previously enjoyed activities, excessive worry, withdrawal from social contacts, or expressions of hopelessness. These symptoms, especially when combined with significant changes in sleep patterns, warrant prompt professional evaluation. For long-term management of the emotional dimension of daytime sleepiness, several approaches have proven effective. Maintaining social connections is paramount. Regular, meaningful interaction with others provides emotional stimulation and purpose that counters the tendency to retreat into sleep. Purposeful engagement through volunteering, mentoring, creative pursuits, or continued learning creates rewarding experiences that make waking hours more fulfilling than excessive sleep. Establishing daily structure is particularly important during transitions like retirement, when the external scaffolding of work schedules disappears. Creating a written daily schedule with planned activities, social interactions, and even small pleasures can provide both motivation to stay awake and rewards for doing so. Light exposure plays a dual role in addressing both the physical and emotional aspects of sleep regulation. Morning bright light not only helps set your circadian rhythm, but also influences mood-regulating neurotransmitters. Spending time outdoors combines the benefits of light exposure, physical activity, and connection with the natural world, all shown to improve both mood and sleep regulation. For some, professional mental health support through counseling, therapy, or appropriate medication may be necessary. Approaches like cognitive behavioral therapy for insomnia, CBTI, have been specifically adapted for older adults and address both the emotional and behavioral components of sleep disturbances. What makes this dimension particularly significant is that addressing the emotional aspects of daytime sleepiness often leads to improvements in other areas we've discussed: better nighttime sleep, enhanced cognitive function, and increased motivation for physical activity, creating positive upward spirals rather than the negative cycles we discussed earlier. As we prepare to conclude, remember that understanding this emotional dimension doesn't mean daytime sleepiness is all in your head. Rather, it acknowledges the complex, bidirectional relationship between our emotional states and physical well-being that becomes increasingly important as we age. As we've explored these 5 critical dimensions of daytime sleepiness in seniors, we've uncovered a complex picture that goes far beyond simple tiredness. Let's briefly recap what we've learned. Disrupted nighttime sleep creates a foundation for daytime drowsiness through fragmented sleep architecture. Medication side effects can act as hidden energy thieves, particularly as our bodies process drugs differently with age. The cognitive connection reveals important relationships between brain health and sleep regulation that can signal early changes. The physical activity paradox demonstrates how movement creates energy, while inactivity leads to further fatigue. Finally, the emotional dimension shows how sleep sometimes becomes an escape when waking life loses meaning or pleasure. Together, these 5 factors paint a comprehensive picture of daytime sleepiness that's far more nuanced than the simplistic view that seniors just need more sleep. Understanding these interconnected elements gives us the power to address daytime sleepiness as the complex, multifaceted issue it truly is. I want to emphasize that experiencing daytime sleepiness doesn't mean you're simply getting old, or that you should accept it as inevitable. In most cases, there are specific, identifiable factors contributing to this issue that can be modified or addressed with the right approach. By working with healthcare providers who understand these dimensions and are willing to look beyond simple explanations, you can develop personalized strategies to reclaim your daytime alertness and energy. If you're experiencing excessive daytime sleepiness, your next steps should include: first, keep a sleep-wake diary for 2 weeks, noting bedtimes, wake times, nap patterns, and factors that seem to influence your alertness. Second, request a comprehensive medication review with your healthcare provider or pharmacist, specifically asking about sedating effects. Third, evaluate your physical activity levels honestly and consider consulting a physical therapist to develop an appropriate exercise plan. Fourth, assess your social engagement and meaningful activities. Are you finding purpose and pleasure in your waking hours? Finally, don't hesitate to discuss both the physical and emotional aspects of your sleep patterns with your healthcare provider. Remember, the goal isn't to eliminate all daytime rest. Brief, intentional power naps of 20-30 minutes can be beneficial for many seniors. Rather, the aim is to distinguish between restorative chosen rest and excessive involuntary sleepiness that diminishes your quality of life and may signal underlying issues. I hope this exploration has empowered you with knowledge that can transform how you understand and address daytime sleepiness. By recognizing these 5 dimensions and taking action, you can potentially reclaim hours of alert, engaged living each day. Time to enjoy the people, activities, and experiences that make life meaningful at any age. If you found this information valuable, please help us reach others who might benefit by liking this video and sharing it with friends or family members who might be experiencing these issues. Leave a comment about which dimension resonated most with your experience. Your insights might help others in our community. In our next video, we'll be exploring how to optimize your bedroom environment for better sleep quality as you age, including specific adaptations that accommodate changing sensory needs and physical comfort requirements. Subscribe now so you don't miss this important information that builds on what we've discussed today. Thank you for joining me in this exploration of what daytime sleepiness really means for seniors. Remember, understanding is the first step toward positive change, and it's never too late to improve your sleep patterns and reclaim your daytime vitality.